Good evening, everyone. Good evening, sir.
Good evening. How are you?
So I'm doing fine. Uh, so all the aspirants have joined us. So shall we start,
Could
sir?
you could you see the site's slideshow? Could you see the PowerPoint?
Yes, sir. The presentation is perfectly visible. So, sir, shall we start?
Okay. Um, how many are? I just want to be sure how many candidates do we have here?
Uh,
Okay.
Six
Okay.
students right now. More will be joining us. So, good evening,
Okay.
all the aspirants present here. The topic for today is general topic. It is a CBS session, and the speaker that we have here is Dr. Fathy Elshazly. He is a specialty registrar at Northwest Deanery NHS Hospital, England. Yes, sir. So you can start. Thank you.
Okay. Good evening or good afternoon, wherever you are, good morning, wherever you are. Today it will be a rehearsal about case-based scenarios according to the EDIC exams. Um, if you are if you're not aware about the structure of the EDIC exam, it's 2 days. It's being run over 2 days. The first day is about case-based scenarios, where you are going to have three stations. The first station, there is no special order for it. One station will be about biochemistry, where you have going to have some vignette, short vignette about or short case, and they're going to give you the lab results of this case, whether this lab is just renal function tests, liver function tests, complete blood count, or blood gas, and you expect to have a lot of blood gas. It's going to be about 8 cases over 12-minute period. And the second one would be radiology. We are going to see CTs, ultrasounds, X-rays, MRIs, and then they're going to show you 10 slides. And the third one is going to be about curves. These curves include ECGs, ventilator curves, ROTEM or TEG curves, intra-aortic balloon pump, pulmonary artery catheter, whatever the curves are there. And sometimes they are just innovating. They give you some new curves. Sometimes they're giving you EEGs or any other, or even monitor slides from a monitor bedside, and they ask you to give an interpretation of what you see, or capnography, or arterial line, whatever curves it is. And the second case as case-based scenarios, which are longer case. The hardest part of the ethic exam are usually in the first day. On the first day, where you are going to face case-based scenarios, because usually it's very limited time. It's about time management and about how to hold your nerves and pull yourself together during those about 30 slides, which you are going to see. My advice, and usually, especially it's not difficult. It's not difficult at all, but it's about, because some of those slides some of those questions you might find them sometimes silly, and sometimes they are not clinically very relevant, and sometimes, for example, like the arterial line waves forms, it's no one depends on the can interpret arterial line waveforms form. I'm sure that you know a lot of consultants, great consultants, who don't usually interpret arterial line waveforms. And maybe you are not working, for example, in a place where you have got intra-aortic balloon pump or arterial line or pulmonary artery catheter. And so it's more difficult for those who have finished their training or their certificates long time ago, and they have been only working clinically. That's why usually it needs more work and more studying and more exposure to questions. Especially regarding the curves one. The radiology are usually easy, and as you're going to find, usually easy, no tricks about it. And my only advice during the CBS, don't assume that there are there are no tricks in the CBS. They are just simple questions, and especially regarding interpretation of the biochemistry or the arterial blood gas analysis. Don't assume that there are tricks. Try to be as simple as you can. Do whatever you do every day in your everyday practice. For example, I know that if you attended the European Society of Intensive Care Medicine course, they will teach you how to use the Stewart method or strong ion difference method to interpret the blood gas. It's okay and fine, you can use it, but if you are not using it in everyday practice, don't use it in the exam. The exam is about time management. Try to be as simple as possible. Try to answer the question directly. The first thing comes in your mind, just say it. If you are not using strong ion difference or Stewart equation in everyday practice, and you cannot do it in less than 30 seconds, don't do it. And whenever you face difficulty in any of the slides, just ask to pause. And then you can return it back on. Because if the time slot, if there are 12 minutes passes without answering all the questions, they cannot give you the points for those questions or the marks for those questions. But if you say pass, then after you finish the question, you might return, after you finish all the questions, you might return back to any question you want to change your answer or edit your answer, or you haven't answered and you want to give an answer now. Okay, so whenever you face a difficulty or whenever you struggle, ask the examiner to pass this slide and you might return it to it later, because don't waste time. The most important part here is to pull yourself together and time management. And please, this is a rehearsal. This is just to give you an idea about the atmosphere of the exam. Without your participation into this session, it's useless. If you're not going to participate with me, and if you can open your cameras, I would appreciate it really, then so that you can practice the atmosphere of the exam. Because in the exam, you're going to open the cameras and you have to be visible all the time. And if you cannot open the cameras, just participate, please. Because if you're not participating, this session is useless. I'm not going to teach you anything new. I'm not going to teach you anything you don't know in this session. I'm just going to give you an example of what the exam will be. Okay? So let's start, please. This is an MRI and a CT for a 20-year-old patient who was admitted with low GCS. The MRI was before the procedure and the CT was after the procedure. Would you interpret, please, the findings of the MRI and the CT and specify what kind of procedure did the patient have? So I just need to see the participants. Let's go one by one. Anyone would like to participate? And would like to answer this question? Let's go by
infarction.
Huh? Who is it? Sorry.
Cerebral infarction.
Mr. John. Okay, Dr. John. Okay. Cerebellar infarction. That's great. Which lobe of the cerebellum is affected? Or
Left lobe.
the right or the left lobe. Okay. So, what do you think the procedure that this patient had? What is the procedure? Okay, could you see this? What is this? Okay. This is an EVD. EVD, which is being a catheter which is being inserted into the ventricles with patients who have got obstructive hydrocephalus in order to reduce the ICP and improve the cerebral perfusion. As you mentioned, you are right, Dr. John, it's infarction involving the right parieto-occipital loop and cerebellar hemispheres, worse on the left, progressive dilatation of the ventricles with basal cisterns effacement, likely related to cerebral edema. Of course, the hydrocephalus is not obvious into these cuts, but you would expect any patient with this size of infarction that he might develop hydrocephalus at some point. And the other CT, which is 1 day post-op, decompression of the lateral third ventricle. However, the posterior fossa remains crowded with effacement of the fourth ventricle. Don't skip. This is, of course, a radiological interpretation of the CTs, but you are not expected to say all of this. You are expected just to say the obvious findings. You are not radiologists. You are not expected to say anything detailed about the pictures. So you are right. It's infarction, cerebellar infarction. So the next question is, what you would like to do for this patient? What other imaging or investigation you would like to do for this patient? Any volunteers? Or Dr. John, would you like to answer this question?
Yes, I would like to do a cerebral angiography in order to try to detect where this or the obstruction is likely to be, most likely in the posterior brain, posterior circulation.
Very